Hello, everyone. Hola, bonjour, buonasera. I welcome you with great pleasure to session 1 of Nursing on the Front Lines of the Climate Crisis, Education for Action. I'm Dr. Gina Friel. I am a pediatric nurse practitioner and director of the Global Nurses Working Group at Columbia University Mailman School of Public Health in the United States. 2 years ago, this moment was a dream. That dream evolved into a vision. Today, this course is the first of its kind, being brought to over 2,000 nurses and participants in 132 countries throughout the world. Standing on the shoulders of the work initiated by Dr. Natasha Sood, Dr. Cecilia Sorensen, and the Climate Resources for Health Education team, this course has been created by nurses for nurses. It is rooted firmly in the collaborative efforts of the Global Nurses Working Group and the Nursing Climate Resources for Health Education, in addition to the amazing members of the Global Nurses Working Group core team, each and every one of whom are nursing experts dedicated to this mission and steadfast in bringing this climate and health message forward to nurses globally. My deepest gratitude to Dr. Karen Duderstadt, Dr. Michelle DePhillips, Haley Campbell, Nico Hamaker, Dr. Katie Huffling, Dr. Hannah Noel, Kara Cook, Helen Boyd, Raluca Radu, Caitlin Richards, and to each and every member of the dynamic and amazing core team. Your passion for this work, depth of insight, energy, and enthusiasm continue to inspire me and this work every day. I would also especially like to thank our partners and supporters in this course. Our partners include the Alliance of Nurses for Healthy Environments, the Canadian Association of Nurses for the Environment, and the Climate Action Nurses in Australia. Our supporters include the M. Louise Fitzpatrick School of Nursing at Villanova University and the Columbia University School of Nursing. We are here today and for the next 10 weeks to learn from our expert speakers and also from one another, with a common goal to improve our understanding of these topics so that we can increase our knowledge and skills to take better care of our health, the health of our patients who entrust us with their care, and the health of the planet that we all share. Nurses shine in their ability to take complex topics and relay this information to our patients and families in an effort to meet people where they are and build a common goal justly and equitably. Nurses are trusted and ranked the most honest professional field in the world. This is a safe space to come together. I encourage you to attend all 10 sessions, either live or asynchronously, as the content of each session will build upon each other. Consider the information presented and try to imagine how it might be applied personally in your families, communities, workplace, geographic location, internationally, or on a planetary level. Education for action. This is what joins us together. So let's begin. First, a few housekeeping reminders. I encourage you to refer to our website listed in the chat. Here you will find our course objectives and course schedule, along with very detailed information and session resources. A certificate of participation will be offered. Participants who attend at least 7 out of 10 Zoom sessions or view the recordings and pass the final course exam with a score of 70% or higher will be awarded a certificate of participation. Please note, it is mandatory to join the Zoom classes, watch the video recordings, take the session post-test and end of course survey utilizing the same email address. Attendance will be automatically recorded during the live Zoom sessions and video recording views. Attendance is not counted if you join with a colleague's link. The final exam will be sent out on the final day of class via email and WhatsApp and will remain open for 48 hours. The format will be 20 multiple choice and true-false questions, and the exam must be taken in one sitting. Next, I will jump over to Dr. Hannah Noel, who will discuss the continuing education for US-based participants. Hannah, welcome.
Thanks, Gina. Hi, everyone. My name is Hannah with the Alliance of Nurses for Healthy Environments. I wanted to share a little information about how you can obtain your course certificates and nursing continuing education credits. All of those who registered for each event will receive a follow-up email in 2 to 3 business days that includes detailed instructions on how to navigate to Annie's learning site, how to create an account, enroll in the course, watch the video, and take the evaluation and post-test. Those who attend each session synchronously or live will also receive a password that allows you to bypass the video. Again, I just want to say thank you so much for including me and the Alliance of Nurses for Healthy Environments in this incredible webinar series. And I'll pass it back to Gina to introduce you to our first speaker.
Thank you, Hannah. Just as a reminder, each session will be 60 minutes in length. It will end with a question and answer section. Please note the questions for the presenters must be entered into the Q&A and not into the chat. The session slides and video recordings will be posted after each session and will be available on our course website, which is again listed in the chat. Now, it is my pleasure to introduce Dr. Teddie Potter, a dedicated leader and driving force behind the global Nursing for Planetary Health movement. She is the inaugural director of the Center for Planetary Health and Environmental Justice at the University of Minnesota's School of Nursing and a fellow at the university's Institute on the Environment. Dr. Potter holds prominent roles in several key organizations, including the Alliance of Nurses for Healthy Environments and Columbia University's Global Consortium on Climate and Health Education. She also serves on national committees such as the National Academy of Medicine's Action Collaborative on Decarbonizing the U.S. Health Sector. Her most recent work is founding with the International Council of Nurses, Nursing for Planetary Health, a global movement. It is my pleasure to welcome Dr. Teddie Potter.
Good morning, good afternoon, good evening, and if you're watching in the middle of the night, good night to you as well. It's very wonderful to be in the midst of you, and I got a little choked up as I saw all of you come in and the places that you're coming in from. Dear colleagues, dear places around the world, and nurses that are taking action. So thank you for being here. Thank you for being part of this opportunity. And thank you for all the planners that have put in tremendous hard work in designing the curriculum of this program. It's very difficult to cover climate change, the science of climate change in 45 minutes. And I know that I'm giving my scientific colleagues a heart attack thinking that I can cover the science. But I'm giving you a broad overview of what you need to know as a nurse and what you need to know in order to explain it to our patients and families and to keep people safe. Next slide, please. So here's the objectives. While you look at those, I want you to know that this is like a good movie. The very first show is going to be a snapshot of what's yet to come. The people that are coming in the next 9 weeks are incredible experts in their fields. So I might mention an area that they're speaking about, but they're going to be filling in a lot of the details and a lot of the gaps. This is just to give you a taste or a foundation in order to be ready for the talks that are coming. Next slide, please. So this is important to understand that climate change is a global challenge. There is no place in this planet, no place in this world that climate change is not having an impact. It is being felt everywhere. but it's also hyper local, in that you need to understand what's happening in your space, in your land, in your country. Otherwise, if you're just talking about severe storms and your country's having severe droughts, it won't resonate. So you need to understand what is going on in your country so you can speak the language and use the examples of your nation and the impacts of your people. Plus, as we prepare nurses to be involved in disaster preparedness and to be able to help people adapt, we need to understand clearly, what are we helping people adapt to? And so it's a global issue, local problem. Next slide, please. It's also got its foundation in human behavior. So this is the a model that shows how planetary health works, in that social norms, our patterns of consumption, our demographics, our technology have all teed us up to disrupt the Earth's natural systems. Because of that, we are seeing massive, massive changes around the planet. Climate change is just one of the issues. Biodiversity loss is another. Pollution of our air, soil, and water is another. All of these issues are grounded in human behaviors. They're not natural patterns. They're not natural disruptions. Humans are causing this problem. Humans can get us out of this problem. So it's really important for those of us who are nurses, who are really good at behavior change, to help people understand, how do we shift our behaviors to put a stop to this destruction. This slide also talks about whether somebody feels the health impacts to a great extent or a lesser extent. It depends on all sorts of factors, such as where they live, their education, their gender, their ethnicity and race, their general overall health. All of these play also a role in this situation. Next slide, please. So as I said, climate change is one of the issues that we're seeing, but this is a multifocal issue, a multi-problem situation that we're dealing with. And these are humans caused situations, as I said. We're cutting down forests at an alarming rate, which actually alters the ecosystem and impacts whether rains fall or not, rains don't fall. Biodiversity is being lost at 1,000 times the normal rate of biodiversity. As a matter of fact, we are currently in the 6th extinction. It's not an asteroid causing loss of life, it's human behaviors. The ocean is becoming acidified, which alters our fisheries and our ability to draw food from the oceans. Land is becoming desert. We have soil, air, and water pollution. And keep your eye on plastics. Plastics is a huge emerging issue. Rivers are running dry and not able to support people with the water they need. Extreme weather events. We just experienced Hurricane Helene in the United States, but there's a major typhoon affecting Taiwan right now. So this is a universal global problem of these extreme weather events. Temperatures are on the rise and sea levels are rising. Next slide, please. So why are we talking about this? Why now? In the past, it seemed like we would see the worst. We would be seeing evidence of climate change, the impacts of climate change, in the year maybe 2100. No, we're seeing it right now. Right now, our communities are, and the people in our communities, their lives are being threatened. By 2050, there's going to be 14.5 million additional deaths related to climate change and $1.1 trillion economic impact related to climate change. This is what they said we have to do right now. We have to have comprehensive health system transformation. We can't continue business as usual. We can't continue to operate our health systems the way they've operated in the past. And we must have global collaboration. Today's the day. We're here. Look at the people in the chat, where they're from all over the world. So we're starting this collaborative effort right now. Next slide, please. So a little bit about the basics. What is causing this? What are the problems here? There's the greenhouse gases. And so the greenhouse gases, certainly you hear about carbon dioxide a lot when you hear about global climate change. The reason you hear about that a lot is the greenhouse gases, the largest percentage is carbon dioxide. But methane, CH4, is also an issue. Nitrous oxide, N2O, is another issue. And then our fluorocarbons make up 3.1%. So greenhouse gas is an atmosphere problem. We're polluting our atmosphere. We're going to get into in the next slide how that's happening. But all of these gases stay in our atmosphere for different lengths of time. What is putting these gases in? Well, 35% transportation, 30% electricity, 16% industry. And then housing and commercial buildings is another 12%. We can't get off the hook here, folks, as healthcare professionals and healthcare providers. In the United States alone, 8.5% of our greenhouse gas emissions are from the healthcare industry. Globally, if we were a country, if the healthcare industry was a country, we would be the 5th leading producer of greenhouse gases. That's crazy making. We are supposed to be preserving lives, protecting lives, caring about people. And on the other hand, we're emitting the gases that are leading to illness and death. We have got to do something about that. Next slide, please. And again, it's multiple gases. The reason to know about that is there's multiple causes that we need to address. So carbon dioxide is primarily due to the burning of coal, natural gas, oil, also trees. So we need to understand that as people start to burn forests to get more land for agriculture. Anytime we're burning biological matter, we're releasing carbon that has been stored in those plants to the atmosphere. And carbon dioxide, there's a little typo here, stays around for 100 to 1,000 years. Methane is released in the transportation of coal, natural gas, and oil, but it's also released from livestock. You've perhaps heard about cows emitting gas as they belch and as they excrete gas out the other end, and that's true. They because they're ruminants, because they eat grass and they break down grass and crops, they are releasing methane. Land use and the decay of organic matter is contributing to this, our solid waste landfills. And as our permafrost starts to melt in the Arctic or across northern Siberia, huge amounts of methane are being released. Nitrous oxide is from agriculture, land use, and industrial activities, wastewater, fuel, fossil fuels, and that lasts 100 years. Hydrofluorocarbons, especially some of our anesthetic agents like desflurane, last 1,000 years, and it is a potent greenhouse gas. Next slide, please. So we have a saying in the climate field is if you emit, you commit. That means that once these greenhouse gases have been released into the atmosphere, we can't just snap our fingers and be done with them. We can't just figure a technology that pulls it all out. These are around for thousands of years. So it's very important to understand that every little piece that we contribute now enters the atmosphere and causes problems. Here is a little graphic about how healthcare contributes to the emissions of greenhouse gases. We burn fuels or use energy on site to keep our hospitals or our clinics going. Our ambulances and vehicles emit greenhouse gases. We use the anesthetic gas, as I mentioned, some of them causing greenhouse gas emissions, and our refrigerants. We also purchase electricity. We purchase steam that has been fueled by the burning of coal and other fossil fuels. But by far, it's scope 3, which does involve our production of pharmaceuticals and our production of medical devices, our production of food, and our disposal of waste, and all our transportation. So we've got a lot of work to do as health professionals to start to cut back and draw down. Next slide, please. So once these greenhouse gases, what be they methane or carbon or fluorocarbons, get released into the atmosphere, what happens? Our planet is situated a perfect distance from the sun. We're not too close where we burn up. We're not too far where we freeze. We're just perfect. And what keeps us in that perfect range is this tiny, tiny little atmospheric layer. That atmospheric layer, in the best of all worlds and prior to the emergence of the Industrial Revolution, was it allowed radiant energy from the sun to come in, and what we didn't use and absorb as plants, etc., radiated back out into the universe, or out into beyond the atmosphere. And this was a great system. It worked flawlessly. It worked very well until you start pumping particles into this thin little layer that shouldn't be there. So as we burn fossil fuels, burn coal, that layer gets thicker and thicker and thicker. And the radiant heat that comes in from the sun can no longer radiate back out. It stays in here. It stays wrapped around the earth. Now, in Minnesota, I can use this metaphor because we have cold winters. If I'm cold in the winter and I pull up a blanket, I don't immediately get hot. I shiver under the blanket, and eventually enough warmth is collected that I get nice and toasty. The earth is the same way. We are adding blankets to the earth, but there's a lag time. It doesn't heat up immediately. There's about a 30-year lag time. So the amount, what we're experiencing right now, our levels of carbon dioxide, our rising sea levels, our heat episodes, our extreme weather events are related to how much greenhouse gases were in our atmosphere 30 years ago. That means we have 30 more years baked into the system already of things getting worse. Even if we stop tomorrow, even if we went cold turkey and stopped burning fossil fuels, we have 30 more years already in the system of things getting worse, because what we're seeing now is related to 30 years ago. Next slide. So once these are in our system, what's going on? Well, you can see from ice cores that they got from Antarctica, you can see that there have been periods where there's been high levels of carbon in our atmosphere and low levels of carbon in our atmosphere all through history. And it's just this natural pattern. When the levels have been high, it's been more of a tropical Earth. When the levels of greenhouse gases are low, we've had ice ages. This all through history has been normal, and it's vacillated somewhere from 150 parts per million of greenhouse gases, which is where we had an ice age, on up to about 300, which is the previous highest level of greenhouse gases. We are now, as of this past August, at 422. We have never, ever, ever seen this. The NASA engineers, James Hansen scientists, figured out that 350 is the highest we can go and still have life on this planet as we know it. We're at 422, people. And this June was the warmest June ever on record. Next slide, please. And if you don't believe me, take a look at the data from the National Oceanic and Atmospheric Administration in the United States. Look what's happening to our nation as far as it warming over time, just since the 1900s. Next slide, please. And this is the global picture. Every bar represents the temperature of the Earth or the globe around the world. Look at this. Same picture, same imagery. We are burning. Next slide, please. And all of these have health impacts. This is a famous slide from the Center for Disease Control and Infection, and it shows that these issues related to climate and disruption of our Earth's natural systems are leading to changes in systems that are also having health impacts. So in the next 9 sessions after today, you're going to have a wonderful opportunity to do a deeper dive into these various experiences that are occurring. And so I'm not going to cover them in depth other than to say, look at this. Every human system is being impacted, from zoonotic diseases to respiratory status, cardiovascular accidents and injuries, heat-related issues, and then the social needs, the needs in order to survive, the need to migrate to a place where it has livable conditions. We're also seeing threats to our food security and our water security. This is a huge health issue. Don't let anybody say that climate change is just for scientists to solve. This is up to health professionals to understand this and take action now. Next slide, please. And it's an economic issue, and I realize this is a map for the United States. I did not have data for the rest of the globe, but you could probably find for your nation how much money is being used each year based on disruptions related to climate change. So this is the data from 2023. Millions of episodes causing around the country, causing huge disruption to people's lives, their ability to work, their housing. So it's not just physical health, it's also all the environmental determinants of health, all the parts of that nurses understand are connected to whether people survive and thrive. You have to have adequate access to food. You have to have housing that can protect you. You have to have a job or some form of income that will allow you to bring in enough money to meet your basic needs. Climate change is threatening all of that. Because of that, it's threatening health and well-being and mental health. Next slide, please. This is a slide or a quote from the Lancet Countdown of 2019. Every child, the life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food, and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated intervention, this new era will come to define the life of people at every stage of their lives, the health of people at every stage of their lives. So in 2019, I would share this slide and I would talk about this slide. We've got to get action. We've got to get acting fast. Otherwise, this is our future. What I'm here to say today is 5 years later, this is our future. This is what we're looking at. This is not an if, it is a when, and it is a now. So it's important for all of us to recognize it's happening, that nurses need to be involved, and we need to be acting fast to protect the people that we care for. Next slide. So it depends generationally. If you're born in the 1950s or 1960s, yes, you're going to be experiencing some higher heat incidents and some extreme weather events. But look, if you're born today, what a child is facing. That's really, really important to understand, because we need to take action in order to protect those that are just coming into the world and those that have yet to come into the world. This work depends on us thinking about future generations. It depends on us recognizing that the unborn people and beings, non-humans, have a right to a world that they can thrive in, but they don't have a vote and they don't have a say right now. We have votes, in many countries, and in many countries we have an opportunity to speak out. And so it is up to us to speak on behalf of future generations, as well as the rest of life on the planet. Next slide, please. I would love to say that climate change is the only issue. It's as though the planet is a multi-system failure. It is not going to die. It's going to rebound really well. Humans might not do well, but the planet is going to do just fine. But we are disrupting these systems on which human life depends. The Stockholm Resilience Center, Stockholm University in Sweden has found that there's 9 planetary boundaries that can't be crossed. Climate change is one of them, land use, water, our chemicals that we put into our soil, the status of the ocean. All of these are critical to maintaining the life support that the planet offers. In 2009, we had crossed 3 of those boundaries. By 2015, 4 of those boundaries. And by 2023, 6 of those boundaries. So you might say, gosh, she's so gloomy, and she's just so hopeless. I am not hopeless, but I am also saying it's important to wake up and to recognize that this situation is real and it's happening now, and we need to take action. Next slide, please. So as I mentioned, all of these things have impacts on human health. We can no longer say as a health professional, oh, that's not my work to do. That's not my business. It is our business. These disruptions to Earth's natural systems, these threats to Earth's natural boundaries are bringing forward increased problems with human health. Cardiovascular diseases are on the rise, respiratory diseases, especially asthma and chronic obstructive pulmonary disease. We certainly know that zoonotic diseases are shifting and changing. We all just lived through a global pandemic. Antimicrobial resistance, toxin and dioxin exposures, heat strokes, and heat stress are a huge issue for much of the globe. Mental health impacts, and you're going to have sessions on each of these, so I'm not going to go into a lot of depth on these various topics. Malnutrition because of the threats to our food security and our water security. Forced displacement. People don't leave their nations and the places they love and the places their ancestors are buried without serious consideration of that choice. And that choice is being driven by the need to go somewhere where you can survive, where you have water, where you have land where you can raise crops, where you're if you raise goats or sheep or cattle, a place where your animals will not be perishing. And all of this global disruption is leading to increases in civil strife and trauma. So nurses need to understand this huge piece. It's impacting us internally. It's impacting our families, networks, communities, nations. It's impacting locally to globally. Next slide, please. There's a few populations that I want to call attention to that you won't be getting a lot of depth on. One is birthing couples. This is a group that sometimes is left out of the information, is left out of our thinking, because we consider, and rightfully so, birth is a very positive experience. It's not a disease state. But there are impacts of climate change on birthing couples. One is the decision to have a family. A lot of young people are concerned about the fate of the planet and whether it's even ethical to have a family. So you might be involved in discussions with birthing couples about their decision making. We also know that that high temperatures are associated with adverse birth outcomes. And so especially preterm births and stillbirths. So we want to make sure as nurses that you're asking people about their access to cooling centers, places where they can have air conditioning if they are pregnant. This is really important that we support people having adequate cooling environment, especially in the late stages of their pregnancy. We know that there's also a rise in hypertension and gestational diabetes related to this whole climate scenario. In addition, if people are in areas where severe weather or extreme weather is happening, they need to have a backup plan. How are you going to get to a hospital or a clinic or have a birth attendant get to your home if it's a severe blizzard, or if severe mudslides are happening, or there's fires that are occurring? We need to be thinking ahead of these events so that we can protect people. Next slide, please. Children are another vulnerable population. And so we need to be watching for them, and we need to be teaching parents about them. Children and elders do not thermoregulate like the rest of people who are in their middle years. And so they can have earlier problems with heat episodes and not be able to shed the heat like people with a more mature system. So we need to be realizing that we have to protect students, young people, children that are outdoors, and protect elders as well. Next slide, please. So we were invited to do a case study for every talk, and I thought, okay, well, I can, talk about a conglomerate, pull things together, sort of make up a scenario. And certainly all of you are probably now seeing the horrific videos coming out of the Southeast United States and out of the East Asia about the typhoons and impact of typhoons and impact of hurricanes. So those are fast-moving disasters. Those are what we think of when we think of climate change. But I also want to help you understand that there's slow-moving disasters and slow impact. So I'm going to tell my story. I live in Minnesota. As I said, we are the land of very cold winters and lots of snow until about the year 2000, when our winters started warming significantly. As a matter of fact, I remember walking out the door on a Christmas morning in 1999, and it was raining. I had never seen it rain at Christmas time, ever. So something was going on. Now we have in our wintertime rain, and it freezes, and then we'll get a layer of snow on top of that. Because of that, we have very, very icy sidewalks, icy driveways, icy streets. That's unusual for us. We're used to snow. We're not used to ice on our sidewalks. So not being used to ice and being somebody that's very fast-paced and, fast-paced nurse, fast walking, I walked out, walking the dog, and slipped on the ice on my driveway and tore my rotator cuff. So just about 7 weeks ago, I had rotator cuff surgery. That is a climate impact. I'm here to say that's related to climate change. That wasn't related to clumsiness or a freak accident. I slipped on the ice that was caused by climate change. Secondly, about a week and a half ago, I had a huge bite on my neck, and it just itched like crazy. And I thought, oh, this is not going away. I used cortisone. I used all sorts of, topical treatments. I took Benadryl, and it was not going away. So I went in, and sure enough, I had been bit by a deer tick, and I had to go on antibiotics to prevent Lyme's disease. That's another climate change problem. So in my own little story, my own little N of one, I'm experiencing the impact of climate change right now. Now, obviously, many, many people around the world have it much worse. I'm very aware of that and very pained about that, of how people who have contributed least to this problem suffer the worst and first. I'm going to say that again. The people who are burning the fewest fossil fuels and contributing the least to this issue are suffering first and worst. And again, it is, yes, urgent crises, extreme weather, flooding, droughts, all of these things, but it's also these slower impacts on health and well-being. So we as nurses who really think in terms of systems and see people holistically, we understand we need to care for the whole person in the context of what they're experiencing. Next slide, please. So just a brief run through some terms that you'll hear a lot about. Sustainability, sometimes people get confused and they think climate change equals sustainability. So I want to share that sustainability can be used even if you're not talking about climate change. And it has to do with reducing, reusing, recycling, making sure that we're meeting our current needs while keeping in mind future generations. And it usually involves an economic element and a social element and an environmental element. And sustainability is really, really important, that our behaviors are sustainable behaviors. That's really, really important, but it doesn't necessarily solve the climate change problem. So I can recycle all that I want to, but that's not necessarily cutting back on the burning of fossil fuels that's causing this layer of the atmosphere to have greenhouse gases. Mitigation, that's our big prevention word. Mitigation is making sure we draw down our emissions, we pull down our emissions wherever possible, and that we preserve our carbon sinks, we preserve our forests, we protect our forests. So an example is decarbonization. What can we do to decarbonize? What choices can we make to decarbonize? Also, can we make sure that our anesthetic gases that we're using are not contributing to the problem? I can tell you, I've been in the climate change work for over 2 decades, and most of our efforts were towards mitigation. As a matter of fact, we felt that it was sort of shameful to say that adaptation was important. We thought we were going to work fast enough on mitigation that we were going to solve this, but it is clear that we're not solving this. So as we're drawing down greenhouse gases, as we're working to decarbonize, we have to protect our citizens because they are already experiencing the health impacts of climate change. And so adaptation is helping people survive and change their behaviors, change their practices, and change their lifestyles so that they can adapt. Sometimes we have to make those changes through policy changes, through decisions that we make as nurses about healthcare, so that we are helping our citizens adapt. And the most vulnerable have to be considered. Those who don't have assets, those who don't have access to adequate housing or adequate food supplies or nutrition. We have to be asking these questions in order to protect these questions. This is not just some people surviving. This is an issue of justice, absolutely. Resilience is working to ensure that all people have the capacity to respond and rebound after a hazardous event. This is nursing, folks. This is addressing all the issues that we know are important in order for people to stay healthy, whole, and survive. So helping people with stress management, helping people with healthy lifestyles, helping people where possible become as mobile as possible, looking at resilient housing, making sure people have access to adequate food. All of this is helping people become resilient. Next slide. Environmental justice is key. If we are going to survive as a species, it is going to be because all of us work together. It's not going to be because we preserve the lives of 1% of us. It's because we work to ensure the lives and health and well-being of all of us. This is essential that we work in this space, that we protect all people from adverse effects of what's happening in our environment. We need to focus on people who live at the front line of climate disasters. So people who live in coastal regions who are seeing some of the worst places, or in places where forests are burning. But we also need to consider people on the fence line who are living on the borders of some of our extraction industries or coal, fossil fuels industries where their health is threatened by the industry itself. So this is a justice issue. It's not something we tack on at the end if we have time. It is fundamental to how nurses care in this future. Next slide, please. There are many, many resources and you'll be learning about them, but it's important for us to be ready for these disasters, to not plan in the midst of a disaster, but to build the relationships, the collaborative relationships, interprofessional relationships that are necessary to have in place the processes and procedures for when a disaster occurs. This is the BRACE model from the Center for Disease Control, but there's other global models out there. But again, the time to prepare for disasters is now. And it's not just preparing for the disasters you've always seen, it's being aware that unexpected things can happen, that there can be droughts and fires in the forests and the jungles of Maui, Hawaii, that there can be profound floods in desert towns and villages. We have to be understanding that climate change is handing us experiences that are unusual and highly unpredictable, and we need to be ready for those events. Next slide, please. Again, be prepared for fast-moving events, but also slow-moving events. I just shared a couple here. Certainly, we're seeing mental health impacts, and you're going to be learning about that in one of our special sessions. The bottom little picture of the skin mark is the classic sign of a deer tick bite. That's a slow-moving response from climate change. Temperatures and weather. I have 50 degrees in Minnesota showing it here. That was on New Year's Eve. And the ice was so thin up in northern Minnesota that it broke up and it threatened fishermen that were out on the ice. Ice is usually so thick in Minnesota that cars and trucks can drive on the ice. This was unusual. I have a picture of pollen producing plants. We're seeing an increase of 21 days where I live in our pollen season. That's a slow moving condition related to climate change, and certainly air quality related to fires. And it doesn't have to be fires that are burning in your location. That jet stream goes around the planet and it can bring a particulate matter from one part of the globe to another part of the globe. So we need to be preparing people to understand air quality, how to be checking air quality, monitoring that, and when it's safe to be outdoors, when it's not safe to be outdoors. Next slide, please. So again, we talk about mitigation, adaptation, resilience. Nurses can be involved in all of these. We need to be thinking about the generations that are not born. Look at our decisions right now. So think about the products that we're purchasing. Think about the things that we use. Think about helping our organizations decrease our carbon impact. Look at our purchasing power and try to shift that culture. And certainly in nations where you're able to vote, making sure that your candidates are realistic about plans to address climate change. Adaptation. Teach all patients, families, and communities how to be safe and protect themselves. Very, very important. And how to deal with these emerging disasters. We can write op-eds, we can be involved in social media and public information. And certainly resilient, as I said, helping people be as strong and whole as possible so that they can adapt to the changes that are coming. Next slide, please. Planetary health is a huge issue. Briefly, I've been talking about it throughout. That's recognizing that climate change is one of the issues. Planetary health is a solutions-oriented emerging field, transdisciplinary field and movement addressing these issues. Next slide, please. It's based on 5 core domains. You will have access to the planetary health curriculum. Primary in this is an understanding that humans have caused these problems, that we have to focus on equity and social justice. It's a systems issue. Think in terms of systems. Get moving and build movements to address this. And most of all, understanding that what we do to nature, we do to ourselves. It's interconnected. Next slide, please. People want to know. There is a shift. People want to know about this. So it used to be that nurses wouldn't talk about this because they didn't want to hurt people's feelings or, cause a concern. People are concerned. Look at this data from the global warming is 6 Americas. This is a survey of Americans, but 28% of people are alarmed, 29% are concerned. They are expecting us to be talking about this. Next slide. So 5 things to remember. If you don't remember anything else, I always tell people these 5 things. Climate change is real. It is not fake. It's not a scam. It's not false news. It is real. It is happening now. It's not at the turn of the century. It's right now. Scientists agree that it's caused by humans. Change has to be urgent. This is a public health crisis, but there's still time to do something. 5 things. If you can't remember anything else, teach your patients those 5 things. Next slide. There are resources, and you will receive a link to this. This is not a video, but it's a video that we created here that to help people see how can a clinician talk to patients about climate change. It shows if a patient thinks that climate change is real, and then we repeat that scenario with a patient thinks that climate change is not real. How do you work that into your conversation in the regular course of having a visit with a patient? Next slide. So what is the most important thing to remember of everything I've said today? Next slide. You're not alone. Take a look at those wonderful people and names in the chat. Look at all the places around the world that nurses are active or willing to learn or want to know about this. You are not alone. Let's find each other. Let's link arms and work together. You will be hearing excellent presentations in the next 9 weeks. I am so happy you're here. We can do this, folks. We can co-create a better future for future generations. Thank you very much.
Dr. Potter, thank you so much for your wisdom and being our inaugural speaker today. We have learned greatly from your insight, and we have some questions. We have many questions in the chat. We will do our very best to address them. And so I will go to one of our questions here. It says, how do we help people to understand that extreme weather, such as Hurricane Helene, that just devastated the United States, is a direct result of climate change? Certain areas in the United States still believe climate change is not real. Ironically, they are often significantly impacted by storms such as this. They still may not believe in climate change despite their personal experience. How do you help us to help our patients and our families, our friends, our colleagues to understand that this is something that is real, and help folks to become on board and to make behavior changes?
Thank you for that lovely question. And it's really a question about how do we care for people. Nurses are trusted. We're the most trusted profession year after year after year. We're the most trusted profession according to the Gallup poll. And so people do listen to us, but they don't listen to us preach. They don't listen to us judge. They listen to us care. So lead with caring. Lead with, how are you doing? It is really, really hot and I'm concerned about you. Do you have access to a cooling center? It has really been really dry and our crops are limited. Are you threatened by not having enough food for yourself and your family? Focus on health right now. And then if they say to you, yeah, I don't know why this is happening, you can say, I bet you've seen some changes. Tell me what you've seen. What's happened in your lifetime that's different from the way things have always been? Well, animals are migrating differently. The pool where we get our water is dried up. We used to be able to predict on monsoons happening a certain time, and they don't happen those times anymore. And you can say, yeah, and you know what's really sad is humans are causing that. That is just not normal. Humans are causing that. They might say, well, what are we doing? We're burning fossil fuels. So what can we do about it? Well, everyone has a role to play. We all have a role to play in decreasing the amount of carbon that's in our atmosphere. So it's leading with care, leading with love, leading with hope, and an invitation to people to join you. So these experiences of mass suffering don't have to go on. People will be ready. They will be ready when the time is right. And so I would say, be a nurse, talk about hope, talk about health, and just plant a little seed. Watch that video that I shared. Plant a little seed of, have you thought about why this might be happening?
Thank you for that. Okay, we'll go to another question here. It says, hi, Teddie. I was wondering, as nurses, when we face the effects of climate change on public health and the worsening of health determinants, which should we prioritize and be addressing first?
Oh, another good question and a tricky question. I don't want to say it's one size fits all. I want to call every nurse to leverage whatever influence you have. So if you are a practicing nurse in a clinic or a hospital, you might want to first look at the amount of supplies that you use. And is there an opportunity to talk about the purchasing of supplies? Or you might want to talk with others about how are you going to respond if your hospital is in a severe weather event. You want to have people work where they're at. If you have an opportunity to be involved in policy decisions or influencing policymakers, absolutely. And every nurse in many countries can do that, of contacting policymakers to make policy decisions. That's also important. But what's the most important act? I think there's a tendency right now to say this is such a big issue that there's no hope. And so the most important act is for nurses to rise and do what we've always done. There is hope. It's really important because people can only act if they have hope.
You've given us a lot of hope today. You've told us a lot of what has been going on. You've also given us some great information on what we can do as nurses in our own scope of practice. I have another question here. It is said that healthcare contributes to about 8.5% of greenhouse gases. Can you please explain how healthcare does this? Which aspects of the healthcare industry are the major contributors to climate change?
Yeah, that's a really good question. And fortunately, you'll have access to my slides. So I would steer you to that one slide that was produced by Practice Green Health, which shows the various scopes, and that lists the multiple ways. Certainly energy use, but also our fleet vehicles, so ambulances, transportation vehicles, which emit greenhouse gases, our production and use of energy to keep the lights on is a green, it contributes to greenhouse gases. As I said, our anesthetic agents contribute to this, but by far the largest amounts are way upstream on our pharmaceuticals and our biotech products and things that we use in healthcare. So keeping our people healthy is a huge strategy to drawing down greenhouse gases. I know that's a kind of a leap, but I am here to say that when we have healthy people, when we can keep people out of the hospital, we've made a large contribution.
I would like to thank you for answering those questions. Unfortunately, we are at our time, and thank you so much to Dr. Potter for joining us today, and to all of you from around the world. We have immense gratitude and for all of you being here and wanting to learn about this so that we can better take care of our health, the health of our patients, and the health of our planet. Please join us again next week for session 2 in this series, vector-borne disease with Dr. Tracy Kelly. Thank you again, Dr. Potter. Goodbye, adios, au revoir, arrivederci. Have a wonderful day. We'll see you next week and for the next 10 weeks.